Testosterone replacement therapy can be given to patients who have symptoms of hypogonadism, as well as patients who have consistently low serum testosterone levels. Now, the indications for this therapy are easy to understand and they're pretty straightforward. But in this video, I'm going to be focusing on the contraindications and the adverse effects. Now, patients who are undergoing testosterone replacement therapy are going to have an increased risk in developing prostate cancer. The reason for this is because testosterone is going to be converted into dihydrotestosterone in the periphery with the enzyme 5-alpha reductase. And dihydrotestosterone is going to have a much higher affinity to the androgen receptor than testosterone. And so this is going to be the major hormone that is going to be growing and maintaining the prostate. And if we have an increase in dihydrotestosterone, then that can put patients at a higher risk of developing prostate cancer because we're going to be growing the prostate. And remember that prostate is going to be producing PSA, so if we have more prostate tissue, then we will also see elevated PSA levels. Now, hematocrit is going to be a really important lab value that needs to be monitored in patients undergoing this therapy. The reason for this is because testosterone can induce erythrocytosis. So what this means is that patients can have more red blood cells in the blood. So imagine that this is a blood vessel and imagine that these dots are representing red blood cells. And so if we have a lot of red blood cells in the blood, then it is going to make it harder for the blood to flow. It is going to make it thicker. And this can promote the formation of emboli as blood slows down. And because the blood is thicker, the body needs to put an extra force for the blood to travel throughout the body. And so that extra force can also damage the endothelial cells lining the blood vessels. And that can also induce emboli formation. Now, this therapy is going to be contraindicated in patients who have severe obstructive sleep apnea. The reason for this is because in these patients, there's going to be a blockage in the upper airway, and testosterone replacement therapy can increase upper airway resistance and it can also increase weight gain, and this can further exacerbate the sleep apnea.